Thank you.
You're welcome.
All right, so today we're going to be discussing, like I said, a couple different opportunities for volunteering with aging and long-term care. Our housekeeping today, so all of our attendees are muted upon entry. Please go ahead and just keep yourself muted during our presentations to keep all background noise to a minimum. Our presentations are going to take around 45 minutes today, give or take. Then we'll have an open question and answer section that's going to take around 15 minutes. And participants will be able to ask questions and unmute themselves during that time. However, during the entire presentation, feel free to utilize the chat box. We are going to have staff monitoring questions that come through the chat box during our presentations. They might reply in the chat box, or they might put that as a placeholder to respond to at the end of the meeting. But feel free to chat away, engage. We'd love to have you here. And now I'm going to pass it on to Carrie, who's going to talk a little bit more about community living connections and aging and long-term care.
Welcome, everyone. We're so excited for this turnout. If it weren't for you, we could not provide the services that we so desperately need in our community right now. Savannah, first slide, please. Just to give you a brief overview of aging and long-term care as a whole, so you kind of have a bigger picture of what we provide. Our main focus is to assist our aging and disabled population with staying safely and independently in their homes for as long as possible. And we serve 5 counties: Ferry, Stevens, Pend Oreille, Spokane, and Whitman. Next slide, please. We are one of 700 AAA agencies in the nation. They were established in 1965 with the Older Americans Act. So if there is a need for services like the ones that we're providing, there are others in the nation. So if you have someone in another state, perhaps, that may need some of these same services, you can visit eldercare.gov, or you can call the 800 number listed on your screen, and they will connect you to the closest AAA in your area. Then you can access much the same services, but the services that were offered are tailored to local needs. So they will look a little bit different from AAA to AAA. We also have an incredible resource directory database listed at the Washington State Resource site, waclc.org. If anyone's looking up information on where to get in-home care, who has respite, whatever those sorts of services look like, you can access that information there. Next slide, please. We offer a variety of services at aging and long-term care. Many of our senior services are contracted with additional service providers within the community to make sure we're filling all the gaps. We offer adult day services, bathing assistance, falls prevention online as well as on the phone, diner's choice and to-go meals in our rural areas, our home delivered meals, our legal assistance, minor home repair, transportation assistance, farmers market vouchers when in season, and online senior fitness classes. Next slide. We also support caregivers and their families. We offer family caregiver support, Medicaid alternative care, tailored supports for older adults to kind of fill the gaps when maybe you don't qualify for something else. We also have Powerful Tools for Caregivers, which is an online class that assists caregivers in really becoming prominent in how they're giving care to their clients. We also offer the Kinship Navigator and caregiver support for our aging and grandparents that are taking care of children. Next slide. We have a variety of Medicaid services as well. We have in-home case management. We offer veterans-directed home care case management, home care referral registry, health homes care coordination, supportive housing, and medication management. Next slide. So in order to access resources at aging and long-term care, your first step is to call our Community Living Connections department. And the phone number is listed on your screen there. Maybe we'll throw that in the chat for you as well. If you're a caregiver, we're also here to support you. So you can give us a call at the same number and we'll get you connected. If you already have in-home care and have been assigned a case manager, please contact that case manager for further assistance if you have concerns about your care needs. Next slide, please. So just a quick overview of what Community Living Connections does. When someone calls for assistance, we are the first step. So our information and referral specialists are well connected within the community and can offer a variety of resources, and can also determine if someone needs further assistance than just a referral to, say, a transportation company. If they have bigger needs than that, then we can refer internally or externally wherever needed to try to meet those needs. If the person is having trouble filling out an application, as so many of us do with technology barriers and maybe cognitive loss issues, we have benefits enrollment specialists that are specific to assist with that. So they can help walk someone through the entire application process, making it streamlined and easy, and then follow it until services start. Next slide, please. If the person has more complex needs, maybe this is going to take a while to really sort out and get services in place, we will refer them to our short-term options counselors who will work with folks up to 90 days or so in order to make sure that all those needs are met. They will do a variety of things, including estate planning, helping get legal assistance needs. Maybe they need some DME in the home, whatever that looks like, they can assist. But the two programs we're going to be talking about today are our volunteer-based programs, Check and Connect and SHIBA. So they will be giving you the information specific to that program as we move forward. Next slide. We have many community partners. These are just a few. We are contracted with many and we refer to so many. We also work very closely with our rural resources department so that we can make sure we're accessing and referring to appropriate and available services in our other rural communities as well. Next slide. Today, we will be talking about our 3 volunteer opportunities within aging and long-term care. Our statewide health insurance benefits advisors, who are everything Medicare and can assist folks with trying to figure out the best avenue to make sure they're getting the most out of their Medicare plan. We have our Matter of Balance program, who assists with falls prevention. It's been an amazing program to assist folks in reducing the amount of falls that we have, which is one of the highest rates in the state is in our area for falls. Check and Connect, which is our volunteer telephone assistance program. Very excited about this one, assisting folks that are isolated during this pandemic. Maybe they don't have a lot of access to leave their homes or don't have a lot of supports or people to talk to. This program has been amazing for reducing social isolation, and we will get more in depth into that as we go. But now I'm going to turn it over to Monica Kudina, who is our SHIBA coordinator, and she will explain the volunteer opportunity that we have for SHIBA. And we will put the information for contacting us in the chat as well.
Wonderful. Thank you so much, Carrie. Good afternoon, everyone. My name is Monica Kudrna, and I'm the SHIBA Program Coordinator for Spokane, Whitman, Asotin, and Garfield counties. Please change the slide, Savannah. Thank you. SHIBA stands for Statewide Health Insurance Benefit Advisors. Our mission statement is to provide free, unbiased information regarding Medicare for Washington State residents. We do this by community commitment through partnership, service, and volunteering. Next slide, please. Our volunteers have a strong emphasis on Medicare counseling. Our services are free and unbiased. Our volunteers counsel folks confidentially on government programs, prescription plan review. We do give referrals to the exchange, and we can tell folks how they work with private insurances and how that works with Medicare. In Spokane County, the SHIBA program is sponsored by Aging and Long-Term Care of Eastern Washington. And throughout the state of Washington, there are 16 sponsoring agencies that serve our state. And overall, we have 225 volunteers statewide. Next slide, please. In the rest of the states, the SHIBA program is called SHIP, Statewide Health Insurance Program. And in California, it's also called HICAP. So if you've got relatives or family that live in another state, they can get help with their Medicare needs as well. Medicare considers the SHIBA program as the grassroots partner. We are the people on the ground doing the education and trying to educate folks with their Medicare and give them the best services that they deserve. A Couple of ways we do this is by personalized counseling, one-on-one help. We do a lot of community outreach. And this is a federal grant program, so we do have measurements that we have to obtain in order for this program to be granted to help the community. Next slide, please. There's an array of people that we can assist. Mostly is folks getting ready to turn 65 or they're on Medicare because of a disability. We also help folks that are dual eligible. Those are folks that are on Medicare and Medicaid. We can assist folks that are uninsured, maybe give them some other pointers of what else is available for them. We help people in the rural populations and then people with low income. Next slide, please. Ways our volunteers help is we access their healthcare coverage. So they come in, there's no coming in right now because we're in COVID. We're all doing everything virtually or over the phone. So we're able to access their healthcare coverage by a phone consult. We triage them and determine whether they're eligible for helping programs offered by our state. We can help the client evaluate and compare plans. We give referrals to agencies and other programs. And then we also educate them on Medicare fraud. Next slide, please. There are some things that our advisors that we can't do. And one of them is recommend a particular company or an agent. But what we can do is supply you with a list that's available in our state and then educate you on what's available. And then you'll get to give them a call and ask what service is available in our area for an agent to talk to. We can also provide 1-800. We also can call Medicare on the behalf of the client. We have a unique ID that's required, and that access us to get information from the client that they may not be able to know or remember, or that they've lost their materials and they have no idea what they have. We're able to assist with that. Next slide, please. Some community outreach that we're currently doing is we have presentations at the Spokane County Library. We have done in the past birthday events. So when someone gets ready to turn 65, we come to listen to a presentation regarding all of Medicare. And then we also have partnership among other agencies as well, where we do community outreach that way. For future calendar events that we are holding, you can go to the Office of Insurance Commission, go to their SHIBA event calendars. All events are posted there, not only for Spokane County, but throughout the state of Washington as well. I also encourage you to go check out our Aging and Long-Term Care website that has a calendar there, and it shows our most up-to-date events that we're holding. Next slide, please. Some fun testimonials that we get from clients. My favorite right there is the roses, rah, rah, rah to SHIBA. What a relief to have someone actually in my corner. We hear this every single day from our volunteers. It is nice that we are here locally and they're able to talk with us and help them educate on what their services are and how to maneuver the Medicare maze. Next slide, please. So in order to be a volunteer, it is pretty extensive. There's a lot to learn. We do request that you submit an application. You do need to pass a background check, and the Office of Insurance Commission does all of that for us. You do need to take a 2-day training course on Medicare, pass an exam. We do ask that you have a commitment for at least a year. Most of our volunteers have been volunteering with us for many, many, many years. And we are asking that you have a minimum of 8 hours a month that you utilize your education to serve our clients. We also do provide continuing education classes that is mandatory. There's 10 months out of the year. And you also have tons more available for you that helps you with the volunteering process. First, you have me. I am your cheerleader. We'll go through the whole process together. We assign you with a mentor that gives you 10 hours of mentorship in order to serve our clients. We have our trainer, Kim, who is local and provides great training for the SHIBA program and the volunteers. And then we also have lots of access regarding the Office of Insurance Commission and a lot of training material, along with a lot of training material on the Medicare.gov website. Next slide, please. So the way our counselors assist clients is during open enrollment, which is currently happening right now, October 15th through December 7th. That is the time of year where our counselors can evaluate and help compare plans for folks who are on Medicare Part D, which is the prescription drug plans, or the Medicare Advantage plans. We also educate folks on Medicare supplement plans and how to shop for them, and how Medicare works with other programs. Maybe you have a retirement plan that you have acquired while you're working. We can educate you on who pays first and all of that. We also educate you on how to pay for all of this and where do I sign up? So we can give you guidance and all of that. And then we also give guidance for folks under the age of 65 and help them with maneuvering Medicare as well. Next slide, please. Currently, I am recruiting counselors and folks to help me do some presentations throughout Spokane. Next slide. If you're interested in joining the SHIBA family, my phone number is right there locally, 509-458-2509. My extension is 201. Again, my name is Monica. And today I have a SHIBA volunteer that's joining us. His name is Lou, and he is going to share his experience of being a SHIBA volunteer. Lou, on to you.
Thanks, Monica. Can everyone hear me? I see heads nodding. That's a good thing. Okay. Hi, everyone. Yeah, Monica asked if I would talk for a couple of minutes, and I just kind of like to share how I got involved in this and what my impressions have been. Kind of on my own journey towards understanding Medicare, and I attended a Medicare 101 seminar, virtual, that Monica was leading, and she also put out a bug in my ear about wanting counselors, and I volunteer some of my time already doing tax returns for AARP, and I really enjoy working with the community. And I figured from a selfish point of view, I could learn more about Medicare and about healthcare and what's available for myself, as well as to be able to help others. I've been doing this for just a little over a year. I call myself a work in process. You saw the training slide that Monica put up. Honestly, that's kind of just the ticket to entry. To me, the real training is after you come on board and you're done with the mentoring. Original Medicare is actually pretty basic to understand. I could explain it in 5 minutes, and I think I could convey that understanding to everybody on the call. But when you start what I call peeling the onion into all the various add-ons to it, and the private-public partnerships, and the supplements available and things along those lines, it's you can never stop learning. And once in a while you get somebody a little ornery that's not real happy with you, but for the most part you come off those calls and you just feel really good about yourself. At least that's been my experience. So I guess I just want to make that as a pitch that you also get a lot of support. I don't know how many times I've called Monica or Kim or Adrian or Michelle or any of the other folks back at the office to say, I've got a client who fill in the blank and I don't know what to do with it. And they're always very patient. They help me do that. And sometimes they don't know either. And, you know, we figure it out together. So anyways, I hope some of you will consider becoming volunteers. I know I'm certainly enjoying it and finding it valuable. I can answer any questions for anyone. I'm happy to do so. Otherwise, Monica, it's back to you.
Perfect. Thank you so much, Lou, and thank you. I appreciate everything that you do for the SHIBA program and all of the beneficiaries here in Spokane. Thank you very much. Our next speaker is going to be Jessica with the Check and Connect.
Hi, everybody, and thank you for being here today. Can everybody hear me? Okay. Savannah, next slide, please. Can you hear me? Okay. So hi, I'm going to talk to you a little bit about Check and Connect today. This is a telephone reassurance program that schedules regularly schedules phone calls with our clients, and this is to help reduce feelings of isolation during the pandemic. The goal is to support individuals and ensure their needs are being met during this challenging time. Our team of volunteers call clients weekly to verify their well-being, connect with them, and refer them to available resources when needed. Currently, there are no requirements as a client to join this program besides being an older adult or an adult living with a disability. Next slide, please. So right now we have about 6 volunteers and myself contacting over 65 clients. We do 1 to 2 calls per week, depending on how the client's needs are. This program works to reduce victimization, health concerns, and isolation, and our volunteers offer socialization opportunities. Next slide, please. Highlights of this volunteer opportunity: you're able to assist the aging population and adults with disabilities with regular phone calls to reduce their feelings of isolation and stress. Our program is completely remote, so you can do it from home. Right now, we're asking for a 6-month volunteer commitment, but that has an option to go longer if you desire. The only things that you need to help volunteer with the program are a cell phone and a computer. We protect your personal information when using your cell phone too, by the way. You are able to determine your hours you work, and you're also able to determine your workload. You get to help our community stay connected during the COVID pandemic, and the volunteer application and orientation with me are very, very easy and simple process. Next slide, please. For more information, you can contact me. I'm the program coordinator, Jessica Lehman. The phone number there and my extension is 250, or you can reach out to Carrie, who spoke at the beginning, through our CLC line. And I also have a volunteer here to speak today. Her name is Kelly, and I'm going to have her take over.
I believe that's my cue. So hi, everybody. I don't want to take too much time, but being a volunteer with the Check and Connect program technically has been a requirement for school, but it has left me with the feeling of I'm doing something greater than myself, reaching out to somebody in the community who may not normally have somebody who regularly checks on them. I like to think is a noble task. I'm actually from the Seattle area, but I recently moved for school. And one of the newspapers back home in Seattle is the Seattle Times. And one article that they published a while back was talking about like the mental health project. And there is an article that says it's the pain of loneliness. And it really goes back to the why of Check and Connect exists. And that happened because of COVID. But while I'm on the subject of news articles, Aging and Long-Term Care has been sending, I guess it's called the Insider, and we get it once a month. And recently I just looked at the November and December edition, and it goes through like it can welcome new employees, gives shout outs, it gives updates on programs. There's some little activities, and I think there was a recipe, which maybe I might try, I'm not sure. But anyway, it's a fun way to just keep connected with AltQ. But I feel like I've been rambling, so I'm going to hand things back to Jessica.
So again, thank you everybody for being here today, and I am going to pass it off to Kathy, who is the Matter of Balance Program Coordinator.
Good afternoon, everyone. I'm Kathy Hill, and I'm a Matter of Balance Master Trainer and also a certified facilitator for the Falls Talk program. Next slide, please. Each year in Washington State, more than a quarter of adults age 65 and older report falling. Nationwide, a little more than a third of those adults, those who report an injury that requires medical treatment or restricts their activity for at least one day, from soreness or stiffness to broken bones and traumatic brain injury. For the 65 plus age group, falls are the leading cause of injury-related death. Statewide, Washington has a higher death rate from falls than the national average, and the Spokane County's death rate from falls has been even higher, as much as double the state's average. Falls among older adults are the leading cause of injury-related hospitalizations and deaths in Spokane County. So AltQ's been trying to address that. Now, older adults' fear of falling and the potential negative consequences is well-founded. In response, they may withdraw from activity to avoid falling, but that, paradoxically, can make older adults more rather than less likely to fall. Next slide, please. Enter the award-winning A Matter of Balance Managing Concerns About Falls program, which is designed to reduce the fear of falling and increase activity levels among older adults. Next slide, please. Each evidence-based class helps groups of 8 to 12 older adults explore typical fall hazards and healthy ways to lessen fall risk so they can safely engage in activities that they enjoy. So falling is not a natural part of aging, and the good news is most falls can be prevented. Next slide, please. The time commitment for volunteers varies depending on the role taken in the class, but each A Matter of Balance in-person class is made up of 8 two-hour sessions held weekday mornings or afternoons, either once a week for 8 weeks or twice a week for 4 weeks. In-person classes, though, are currently suspended due to the pandemic, and we are offering online classes, which include an additional 2-hour session 0 plus an additional week, making the online class a total of 9 sessions, either twice a week over 5 weeks or once a week over 9 weeks. Session 0, that orients participants to the online classroom so that they can participate in the class successfully. Now, volunteers are key in offering A Matter of Balance free in our communities. So the volunteer roles are coaches, guest healthcare professionals, and specific to the online class, navigators. At this time, we're especially interested in guest healthcare professionals and navigator positions. Slide, please. But to provide context, first a bit about coaches. Next, please. Oh, here we go. A pair of coaches leads each class, presenting the established program curriculum to guide older adults through a number of topics and classroom activities that encourage fall prevention. The adults learn from the curriculum, plus they learn from one another as classmates share from their experiences in discussions that coaches facilitate. For people who are interested in volunteering as a coach, AltQ offers a 1-hour coach information session that goes into more detail about what's involved. And if you choose to continue, the coach training is 8 hours, usually split over 2 days, and to coach the online class, an additional 4 to 5 hours on a third day. So that's 9 to 14 hours of training total. And you choose if you want to do in-person, online, or both. Then we ask that volunteers coach 2 classes within completing training. So again, it's 16 hours for each in-person class, 18 hours for each online class, and then prep and any travel when we get back to in-person classes. Next part of the slide, please. Okay, next one up is the guest healthcare professional, and that is included in one session of each class, so participants can ask questions and discuss balance issues with a medical professional from the community who is well-versed in body mechanics. These professionals are physical and occupational therapists, nurses, exercise physiologists, chiropractors, medical doctors, and doctors of osteopathy. Guest healthcare professionals present a scripted demonstration, and they run a Q&A session that together last about an hour within a Matter of Balance class session. Orientation for this role takes about an hour. So a guest healthcare professional would volunteer an hour per class that they sign up for. And next thing on the slide, please. Okay, so navigators are essential to the online classes. They provide technical support and training to assist program participants who are age 60 and older and other program volunteers with their tech devices, internet connectivity, and the Zoom platform in order for them to attend and interact successfully in a Matter of Balance sessions presented online. Now, you don't have to be a computer geek, but you would need a working knowledge of a variety of devices, including computer cameras, internet services, and the basic Zoom platform features, as well as the ability to explain solutions clearly. The key in this role is dependability and patience, as you will work with people who may have limited experience with technology. The navigator contacts each class registrant the week before class begins to assure their device requirements are working and that the registrant is able to get into the Zoom classroom. So this may be as many as 15 people to get the 8 to 12 participants per class. The navigator also attends each class session, usually for an hour or more, to walk anyone into the classroom who needs help getting there. Training for navigators is via shadowing an experienced navigator through the process. So master trainers such as myself provide volunteer orientations and trainings. We organize the classes that you would volunteer in, and once you are trained, contact you with class dates and times to ask about your availability to fill the volunteer positions needed for the class. We support volunteers throughout each class, and you'll learn more about how we support volunteers in the training. Next slide, please. So volunteer navigators and guest healthcare professionals and coaches too, those are rewarding roles in the online and in-person classes we offer. If you'd like more information, I'll be happy to answer questions in the Q&A session coming up in a few moments. And you're welcome to contact me anytime at Aging in Long-Term Care of Eastern Washington. Preventing falls is a serious subject, but we have fun discussing falls prevention. Thank you for your interest in volunteering. And I believe Mark Haberman is going to talk with you now about the Q&A session. I think that's what's up next.
Absolutely. Thank you, Kathy. And Savannah, if you would take down the slides, please, that'll give us an opportunity to kind of see each other. If you are in a speaker view, we encourage you to move to the gallery view in the upper right of your Zoom window so we can see each other. And I have put into the chat a SurveyMonkey link that we'd like to ask you to take upon the conclusion of this survey. Once the meeting is gone, that link will be gone. So we encourage you to maybe at least tap that now and open that up for your completion shortly. Thank you. So this is our Q&A time, and what I'd like to suggest, since it looks like we're all on one screen here, is we'll go through the programs one by one, and if you have specific questions that fall outside of some of what you've heard already, we'll just ask you to unmute yourself and to ask your question. So we'll begin with SHIBA, Monica Kuderna. Is there anyone that has a question about SHIBA? That would be the Statewide Health Insurance Benefits Advisors, that Medicare advising. Are there questions? You either want to raise your hand or unmute and ask the question of Monica or Lou? Anybody? Going once? If you think of it after a bit too, we can circle back. How about Check and Connect? That is Jessica Lehman. That would be the the reassurance calls, helping people reduce isolation, particularly during these pandemic times. Any questions there for Jessica? All right. Falls prevention, a matter of balance for Kathy. Okay.
I have a question.
Absolutely, Denise.
So did I hear right that that's in person and online? That participants participate?
There are two types of classes. One is in person, and those are currently suspended due to the
Oh, okay.
pandemic. And then there are online classes, and we are offering those. We have been throughout the last year or so. And we've got some coming up winter and spring.
So is all of these opportunities are all remote?
For the Matter of Balance program, we only have a remote right now, but we will have in person when things calm down pandemic wise.
Okay, so there's no requirements of vaccines or anything for volunteers?
At this point, with us being entirely remote, the SHIBA program, the benefits advisors, that is all remote as well, as is the Check and Connect. Everything we've talked about today is remote, correct?
Okay.
Are there other questions, comments?
I have a quick question on the Check and Connect. Do you guys try to work it out so the clients are in the area that you are, or is it more of a whatever clients we get?
So currently we are serving the 5 counties that AltQ serves. I believe it's Spokane, Whitman, Ferry, Stevens, and what am I missing? Monterey, thank you. So those are the clients we are serving as of right now. Most of the clients we have are in the Spokane area, but I have had some from Stevens County. But yeah, right now, like I said, most of them are in the Spokane County area. Not to say that we can't go outside into the other 5 counties that we serve, but right now it's just those 5 counties.
Okay.
Thank you. Are there other questions?
Since these are all remote right now, is it kosher to go see someone personally if you talk to them and find they need extra help that you can't do over the phone?
I'll
And
answer for this. Oh,
Okay,
go ahead, Carrie.
Okay. At this time, what we generally do as best practice is if there's a specific need that you've identified with that client, to please bring it back to the program coordinator so we can triage what sort of referrals and resources that person needs and get a professional involved to help with that. If you choose to meet someone personally on your own time, that is a personal decision that you've made, and it is not connected to the volunteer opportunity in any way. Does that make sense?
Yes.
Thank you. Are there other questions? If not, we'll leave this meeting open for a little bit. The chat, if you scroll upwards through the chat, you will find a link to each program and each contact person. And please take a moment and get those open on your computer. Certainly everything, should you not do that or not get everything you want is available from our website, altcew.org. Want to mention that as well. That final entry into the chat again is the survey. We'd encourage you to jump on and just take a few short minutes and complete that so we can get some sense of your experience of the meeting today. Anything from others of our presenters or others of our guests?
What's this aging and long-term care? What's EW? Eastern Washington?
Correct.
Okay.
Yeah. Well, however you found your way to us, we are surely glad that you were here. We appreciate your time. And again, we'll keep the meeting open for a little bit if you want to chat with any of the people in particular, or again, grab that information out of the chat. So that concludes our program. I want to thank you each for attending and those who've put the presentation together. And hope you have a great rest of your day. Where I'm sitting in Spokane, it looks pretty lovely outside.
Yes, thank you all so much for joining us.
Thank you,
Thank
everybody.
you.